Dr. David Jockers here with my lovely wife, Angel. We're here in our bathroom, and today we're talking about oil pulling and oral hygiene. And so oil pulling is something that, we practice on a daily basis, something I recommend for most of my clients, and it's really an ancient Ayurvedic practice that helps cleanse and detoxify the body. We know that our mouth is actually a carrier. It's a fluid environment, a moist environment, so it's a carrier of tremendous amount of bacteria, yeast, different microorganisms, and microorganism debris. So when we oil pull, okay, and of course we've got coconut oil right here, we're gonna demonstrate this here in a minute, but the oil pulling, putting in that coconut oil, actually helps to grab up the microbes and the microbial debris and helps pull it out of your body. And that's very powerful because the microbes and the microbial debris actually are a stress on your immune system. As they stress your immune system, they actually help to weaken your body. So the more that you're able to eliminate, the stronger your immune system is going to be, the better it's going to be able to fight off abnormal cancer cell growth as well as other bacteria, viruses, different infectious organisms. So very, very powerful strategy for cleansing and healing our body. And so some of the immediate benefits we get when we oil pull, we're gonna notice that we have better breath on a regular basis. We're gonna notice actually that our skin is better, we have better energy in general, whiter teeth. And again, this is because we are reducing our microbial load, getting rid of bad microbes and the microbial debris, the trash that the microbes produce, getting that out of our system, again, helps our body to just heal and repair more effectively. So here's how we do the oil pulling. And Angel is gonna be my assistant here. So as you can see, I've got some good high quality coconut oil, and you can see that it's solid at room temperature here. So it's not melted. And I get a lot of questions from people saying, well, how do I put that in my mouth? It's solid, it's like Crisco, this and that. And I tell them that once you put it in your mouth, it is gonna melt in your mouth in a matter of 10 seconds or so. So don't worry about that. Coconut oil, I believe, is the best carrier oil. It's just the best at, in a sense, helping to grab up these toxins. And it's loaded with lauric acid. And lauric acid is a kind of acid that actually helps stimulate. It has a very, very anti-yeast properties in our body, anti-candida properties. And we have a lot of yeast in our mouth. And so putting that in really helps to reduce the yeast count. And it helps to reduce the amount of Streptococcus mutans. And Streptococcus mutans are kind of bacteria. And when it's overgrown in our mouth, it will produce something called interleukin 12, which is very inflammatory for our body. High levels of IL-12, interleukin 12, are linked with endothelial inflammation. That's the lining of our arteries. And so when we damage and inflame the lining of our arteries, increase the risk of stroke, heart disease, right? Also restricts the amount of blood flow getting into certain areas of our body. Poor blood flow is going to lead to lower oxygen, which is going to lead to higher acidic rates in different areas and more abnormal cancer cell growth. So by utilizing the oil pulling and lowering our Streptococcus mutans levels, we're going to actually reduce our risk of developing those chronic diseases. Okay, so we've got our coconut oil. Now, a lot of people will say to use a whole teaspoon. But if I use a whole teaspoon, I actually get nauseous and gag. It's just too much at once. So using something like a half a teaspoon like this, that is all you need, okay? Unless you've got a Shaquille O'Neal mouth. This is not, you don't need more than this. This is perfect, it's plenty. So then we're gonna take a little bit of essential oil, okay? Now, if you have amalgam fillings, I don't recommend, so if you have silver fillings, I don't recommend an essential oil. But if you don't, okay, if you do not have any silver fillings, essential oil can be really good because the essential oil may be reactive to the amalgam. There's that's a possibility, and that's why we don't want to use it there. But like this is tea tree oil, and tea tree oil is very antimicrobial, so it combines with the coconut oil to give us an even better effect as far as having antimicrobial properties. Now we're just going to put one very small drop. Okay, we got that there. All right, and so now, Angel, you ready for this?
I'm ready.
All right, so she's gonna go ahead and start oil pulling. There we go. Let me know when it's melted. All right, has it melted yet? Mm-hmm. Okay, so 10 seconds, right? 10 seconds, it melts in her mouth. Now what she's gonna do is just swish it around. She's not trying to gargle it or anything like that. just swishing around nice and easy for about 10 to 15 minutes. That's really all you need with this. Just gentle swishing. You know, typically when I'm doing it, I'm checking my emails, I'm reading a book, something like that. I'm not even like intentionally thinking about it. I'm just allowing it to kind of move around in my mouth. And when we do that, that's how we grab up the microbial debris. Okay, that's how we kill off these bad microorganisms and really just enhance our body's ability to heal. So very, very powerful strategy. Now, while she's doing that, I'm gonna talk about some other oral hygiene strategies. So we know that bad oral health is linked with all different types of chronic diseases. So we wanna also floss. And my preferred form of flossing is actually these little brush picks. And the brush pick, my dentist, he's a holistic dentist, and what he told me was that these brush picks work a lot better at getting food particles out of our teeth. So we take these brush picks and we put them in, right? And they actually help to grab up different toxins. So if I put it in my mouth, in my tooth, just like that, okay? Instead of slamming it down like typical floss does, it just actually pushes food particles down. These ones pick them right out. And so they're really, really good. And actually the sharp edges there help to strengthen your gum lining, preventing gum disease. So I recommend flossing every single day, doing your best to get within every single tooth and flossing that as much as you possibly can. And then using a good high quality toothpaste. So right here we've got Dr. Bronner's toothpaste. Okay, we go ahead, we use that. This is all natural, fluoride free, doesn't have any of the chemicals. You wanna look out for things like sodium lauryl sulfates, titanium dioxide. You wanna make sure you don't have those types of things, as well as fluoride in your toothpaste. So natural toothpaste, brush your teeth twice a day ideally. Okay, so ideal strategy is you go ahead, you oil pull 1 to 2 times a day, 10 to 15 minutes. You floss once a day, every single tooth, okay? Within a 24-hour period, reduces plaque formation. And then you go ahead, brush your teeth twice a day, right? Certainly you could do it more, but at least twice a day with an all natural toothpaste. If you do that, you're gonna do a great job at keeping the microorganism balance in your mouth under control and helping improve your immune system. So Angel, how are you doing there?
Doing great.
So she's doing the oil pulling. After about 10 to 15 minutes, she'll wanna spit this ideally in a trash can. The reason why you don't necessarily want to spit it into a sink is because the oil itself could have an effect because it's oily. It could actually clog the pipe. So the general advice is to spit that into a trash can. Okay, so that's oil pulling, dental hygiene. You know, when you do this, when you take care of your mouth, your oral cavity effectively, it again reduces inflammation in your body, improves your skin and your hair, as well as giving you whiter teeth, better breath, and better overall immune system so you can fight chronic disease and live at your highest level. So we'll see you next time.